couple. This one, that one, and the next one are all different examples of the same thing. This is all sarcoidosis. Now we're going to talk about sarcoid in this same chapter, because sarcoid is a granulomatous, non-infectious disease. And we had that yesterday on one of those slides, didn't we? When we had a slide that said common non-infectious granulomatous disorders.
Yep.
I think sarcoid was at the top, I think. And it said most common in humans. It's considered to be the most common non-infectious granulomatous condition in humans. It is very common, actually, especially in Scandinavians, people of Scandinavian descent. It's really common. Boeck was a Scandinavian. That's where the name Boeck sarcoid comes from. Hutchinson was English. Remember Gordini talking about Hutchinson's disease? Mm-hmm. Yeah. Hutchinson was English. And him and Boeck are some of the first to describe what happens in sarcoid. And sarcoid is kind of a continuum in human beings. And it can be discovered in a number of ways. The symptomatology can be very mild. They can get this purplish changes in the skins called lupus pernio in the skin. They can get erythema nodosum, which is painful swelling that happens in the shins. If you've talked about erythema nodosum, it's fairly common in sarcoid patients. That may be how it's discovered. But sarcoid really likes the lymph nodes, and it really likes the lungs, in addition to other areas, including bone. Patients can have sarcoid arthritis. It can attack the small joints in their hands. They can get sarcoid arthritis from it. But the predominant area is the chest, mediastinum and lungs. And this patient has one of the classic findings of sarcoid, which is lymphadenopathy. In sarcoid, if you remember last quarter, we talked about all the paratracheal and subcarinal and hilar lymph nodes. Remember when we were talking about the hilar anatomy? Sarcoid loves the right paratracheal nodes, which are along the lower right side of the trachea, right in here. You see there's an area of kind of water density right here. And it loves hilar nodes. And so it tends to involve the right paratracheal and both hilar sets, hilar nodes. And this is the kind of classic lymphadenopathy appearance of sarcoid. The problem with a patient like this, since this is typically going to be a young female, because females tend to be a little more commonly involved with sarcoid, but this is going to be typically, say, a late 20s, early 30s female patient. So how do we know that this lymphadenopathy isn't coming from lymphoma? The answer is we don't, based on the radiograph. This could be a patient with Hodgkin's disease. This could be non-Hodgkin's lymphoma. There's no way to know. If we look on the lateral, you see how there's an area of increased density right in the center of the chest? Right in here. That's all that lymphadenopathy superimposed. Remember, we talked about enlarging hilar areas last quarter. When the hilus is enlarged bilaterally, which these both are, when they're enlarged bilaterally, it's usually going to come either from the blood vessels, arteries and or veins, or the lymph nodes. Bronchi are almost never bilateral. Bronchi are typically unilateral. You know, like an endobronchial tumor, that's typically unilateral enlargement. So what we have here is bilateral, hilar lymphadenopathy, and right paratracheal. That's the three areas of involvement. So this has a fancy name. This is called the 1-2-3 sign. Very original, isn't it? And it really is just for 1, 2, 3. That's all it is. It's the three classic areas of lymphadenopathy. And almost every sarcoid patient has this presentation at some point in their disease. At some point. From here, a lot of them then start to get pulmonary disease from it. And that may be when they're actually discovered, because they may start having some dyspnea, difficulty breathing, with the interstitial disease. And that's what this one over here is. This is an example of interstitial. So let's look at that.